Okay, guys, so I'm gonna go ahead and get started. And so, oops, hold on here. And that sounds good. Okay, guys, so again, morning. I want to thank everybody for coming here and joining us. Just have a CSCT district update for everybody. So I'm going to go ahead and go through. I am going to deviate a little bit from the agenda that was sent out. The first thing I wanted to touch base on was the MOU. And so as everybody knows, they should have received a letter from me that had an attachment, which was that district MOU that needs to be signed. Again, that is the newest version that was sent out and approved with OPI's chief legal counsel, MTSBA, as well as DPHHS. So we have those out there. We have already started to receive some of those back, and so thank you to everybody that's have sent those in. So everybody else that is remaining, so if you do choose to be part of participate in the CSCT program, as a reminder that per the CMS requirements that in order to be eligible to participate and receive the federal financial participation, that the district needs to have a signed MOU with DPHHS and OPI. Okay, I know that we've gotten some correspondence in regards to the timing of when those need to be submitted, and just for a point of clarification, the letter that I sent out actually does reference February 11th as the date that we're shooting for as a target to try to get all of those in. I have had some communication with folks that their board meetings actually fall after that. A couple of them were on like the 13th and 14th, and we're asking that if they could still submit them in for the month and get reimbursement. And the answer to that is absolutely. And so there is an email for Christine White that I put in the chat box at DPHHS. If you get once you get your MOU signed by your board, then you can submit that to Christine and she can have that, or if you choose, you can always send that to me as well at my email address, and I can forward that on to Christine. But again, if you have it after the 11th, that's okay. We just got to make sure we have it at the drop dead date of by the 15th. Megan Pill is working with her legal counsel just to see if what the requirements are, if there's some flexibility in regards to allowing schools to submit beyond that 15th date and still receive their reimbursement for the January claims that are being processed in February. But again, until we get something from DPHHS, then I would plan on trying to have those in again by the latest of the 15th. Okay. Second thing I want to talk a little bit about is just the match payment. So we know that now, as of December, that the bridge funding has actually been fully exhausted. And so we are at the point now where all claims that are submitted, there's a small portion of it at the end of December, but through January, that those claims will be submitted in January and will start processing in February. And so February is the first month when you will actually have to submit your match payment to OPI to go through that intergovernmental transfer process. Over the process, when DPHHS notifies OPI on that first day of the month, which for February will be Tuesday the 1st, the OPI team will be working to send out emails to the contacts for each one of the districts that we will provide a letter that shows what your guys' actual match requirement is. And let me share my screen and I'll show you an example. So I did send out a letter as well that discusses the IGT process, the timing of everything. Included in the letter was a copy of this certification form. And so you'll read your district clerk or whoever your contact is that we had on that list. And in my letter that I sent last week, there was a listing of contact people. If for some reason that contact person is actually needs to be revised, please send an email to opi.csct@mt.gov, and I also shared that in the chat box as well. And so for the intergovernmental transfer process, if during the submission of checks or match or anything, if you have questions, you can use that email address to submit questions or documentation if needed as we go through the process. Okay. So the form you'll see again is this. It'll address the school itself. It'll let you know that this is your actual certification form and that it needs to be signed by their authorized representative and remitted to OPI with that check payment. And this portion here that says letter insert, this is actual mail merge, and so it'll actually import information into the letter. As you are sending them, there is also a mail to here, which is Office of Public Instruction, and please send that care of the CSCT program so that my staff can easily identify those payments coming in, especially as there's been a lot of questions or concerns about the 10-day window. We know that's a pretty tight window, so if you make sure that you at least put that CSCT program on the envelope, then my team will know to be watching out for those and process them as they come in. If you have questions about the process itself when you're submitting your match payments, I have two support staff that will be available, Bonnie Evans and Catherine McNeil. Their phone number and the email address there is that opicsct@mt.gov that you can use to contact them. And then on the form, it'll have, if you guys remember from some of our previous meetings, that initially we were going to have this CSCT certification form in an Excel workbook. We've actually changed it up so that it's going to be an all-inclusive document that will provide all of the information you'll need to match up to your invoices coming in. This will give you the claim month, year, the provider name, which will be your school district. Each and every one of you guys have a unique provider treating MPI number, which we will provide you as well. And then also the actual match liability that you guys will need to submit for that check payment. And then included on there as well is the authorized representative language that basically that the funds that you are sending in, their authorized rep is attesting to the fact that these funds are coming from a non-federal source as required under Medicaid. And then we'll just have your authorized rep print their name, their title, a signature, and date that. And again, that's what you can send in with your check. So with that said, one thing going back to the 10-day window, that DPHHS had provided us a template of a calendar. Hold on, let me pull that up here real quick. Why is it not showing up? Sorry, one second here, guys. Okay, and so this is a calendar that was put together by DPHHS, and what this reflects is that for each month that claims are going to be processed, it gives you that timeline of when those claims are being processed, the timeline or the window for you as a district to submit your checks to OPI, and then that OPI and DPHHS will process those payments, and then it also will show the actual payment dates that they're going to release the actual funding itself. And so for the example here, this looks at October claims. So the claims will be from October 1st through October 19th. And for the window, that the time frame of when that needs to be submitted to OPI, there is a 10-day window here, which for October would be November 1st to November 15th. OPI will process all the match payment pieces, will notify DPHHS by that 15th date so that they can actually process their claims and process them for remit for payment on that Monday, subsequent Monday for release of the funds. Now, one of the things that we again talked about is the 10-day window. I know that with the mail time, the floating of that, there's been some concerns that time frame of when that may meet up with your guys' boards and have the ability to approve it. And so one thing we'll be working on is actually that we'll have established is I'm going to have a bit of a cash reserve in the fund that the legislature had appropriated to us, made available to us for the IGT process. And the reason why I'm establishing that is so that, in this process, if timing-wise, let's say you have a board meeting that happens on the 14th or the 13th of the month, and your requirement is to have that check payment to us by the 15th, well, once you get that approved, there's no way you're going to be able to get your certification form to us as well as that match payment by that 15th because of the mail time. And so what we're going to allow is that you can take that, have a copy of your warrant in the PDF. You can PDF it along with a copy of your signed certification form, and you can email that to our OPI or opi.csct@mt.gov email address. And as long as we receive that on the 15th, then we'll go ahead and consider that you guys are in the process of sending in that check. We know that you've got a warrant established. You've got the authorized rep that has attested that those funds are coming in and they're from a non-federal source. So OPI I'll go ahead and have my staff release that. And then although we will receive the actual physical payment post that 15th date, at least I've got documentation that shows that your school has completed their end of the process outside of just getting the actual physical check to us. And so I'm hoping that, providing that, a little bit of flexibility and the ability to submit, again, just the documentation attesting that you're going to be sending us that check, that it won't hold up claims and that we won't get in a position where we're having to have those claims released in the subsequent month. So if I know that's kind of a lot in that, and if people have questions on that, we can discuss that here in our Q&A. But again, and my hopes is that will help the process flow better. It'll give you guys a little bit more flexibility in the time frame in that 10-day window to actually meet with your boards to get the warrants approved and then the certification done if that's who your authorized rep is. So if we'll see how that goes, and if hopefully that'll make the process smooth, you guys can get reimbursement without any issues. And then real quick, so in my letter I also addressed that I'm still in the process of getting put together the access.gov system. I ran into a little bit of a hiccup with our contracting and the state procurement, so it's going to take me a little bit longer, but we are looking to actually go live with that in April, starting April 1st. And what that will mean for districts is that there will be, again, that Access.gov portal that you can go to the portal, you can type in your NPI number. The system OPI will have already loaded the match requirements for that month of claims. The system will immediately recognize you by your NPI number, and it will bring up that certification form that I just showed you with all the information that you need to issue the warrant, and then also take to your authorized rep to have it signed, attesting again to that non-federal source. And so hopefully that'll make the process a lot easier. OPI doesn't have to worry about trying to get things out via email. In the event that there's any transitions of the staff that would have received that email, that as long as you guys have that NPI number and we can provide that to you, you'll be able to go in there and access your guys' documents immediately. Again, and should mitigate any risk that things aren't getting lost in email. And so again, more will come to that, but in March, there are going to be 2 scheduled trainings where we'll go over the system itself, give you just a snapshot of what it's going to look like as you go in there, what the functionality of the system is, and any question, and we'll be able to answer any questions you have. If you cannot make those 2 days of the trainings, we're also going to have 2 all-day office hours where I'll have an OPI staff member that'll be available, and so schools can just pop in and out as they have time. They can ask questions. Again, there'll be a staff member available so that they can walk you through the system. As we get closer to that, I'll make sure that I send out another letter, again with another letter with the links, and then just reminding folks that we're going to be looking to do that in April. Okay. Next, I just want to, and then also that everybody should know that the FAQ has gone out, and districts should have received that. At any time, as you guys are reviewing that, if you do have any questions, if you see something there that you believe that maybe needs a point of clarification, then please send any of those requests or suggestions to me at my general email address, and I'll make sure that we take that to the OPI team and we'll take those into consideration, and we will continue to update that FAQ as necessary. Okay, and then little discussion real quick on the bridge funding. So everybody knows that $2.2 million has been fully exhausted at this point as of December 28th. But I have a question out to school districts, and also kind of a comment is, as this has been going through and we had that live meeting on December 29th, it seemed like there was a little bit of disconnect as to who kept the bridge funding. Some schools seem to believe that they actually kept it at the local level because they only had to pay out really that negotiated amount with their mental health centers, which was around that federal participation rate, around that 65%. So they actually had some of that bridge funding that they were able to retain. Others, it sounded like they just took that bridge funding and just passed it directly through to their third-party provider. And so in that process, if you did retain those funds and you still met your invoiced amount for those service, and you still have that match portion of the payment that was received, those funds, because they're actually coming from the state general fund, those funds can actually be used to meet future match requirements. I know it kind of goes across what we've talked about with once your match payments have gone through the IGT process, that they'll lose that ability to reuse over and over. But again, as if the money that you got during that bridge funding time frame that money, if you retained it at the local level, you can use it for future match payments. So we can kind of take questions on this a little later on if you guys do, or if you guys want to have some after the meeting discussions, you feel free to contact me and we can talk about that as well. But just to bring to people's attention that some people may have some of that bridge funding that they received that they've actually retained. So. And the last thing I wanted to discuss real quick was the supplemental payments that was presented or sent out in November from Department of Public Health and Human Services. And so my apologies that it took a little bit for us to get back some guidance on that. We actually had some discussions with Department of Public Health and Human Services and were able to determine that. So the funding itself is coming from, it's an ARP fund supplemental payment. The intention of it is to, I think from CMS is to help to supplement the HCBS service providers or the actual CSCT program itself. And so there's some language that's going to be in a letter coming out, and there was also in our FAQ that talked about the potential use of those funds could be that you as the district may make the decision to pass those forward to your third party provider. In my discussion with DPHHS and understanding is that you, the districts, are actually the provider, and the reason why that supplemental payment was sent to you is that that funding comes to you as the provider. Okay, what that means is that as the provider, you have an amount of discretion as to what you think is the best use of those funds to help support your guys' program at the local level. Okay, that may mean discussions with your mental health centers that a portion of it or all of it may be passed through to them. Some districts may make the decision that they've got things on there at the local level that they in their school district could utilize those funds for. But again, the use of the funds or intention is it's a additional reimbursement for services that happened back in April of 21 that you have already been reimbursed for. You have already paid. You should have already paid your invoices to that third party for those services as long as they've already been submitted to CMS for reimbursement. So the funding itself again is just a supplement for the CST program. So have some discussions at the local level, have some discussions with your mental health service providers, and as a collective, you guys can determine what you guys think the best uses for those funds are. Okay. One note that if you are a school district that made the decision that you are going to retain those funds, again, you can use those to do some, recoding that, in your guys' general fund to move expenditures to utilize that money so that if you wanted to use that, free up your general fund for future match obligations, that, again, your trustees have that ability to make that decision of how to best use the funds that are sent out for that supplemental payment. Okay. So that's all I have just for as an update. So I will open it up to anyone that has questions, and it does look like there's some in the chat. So let me jump in there real quick. Let's see here. So I got a question from Rita. Rita says, my regular board meeting is not until the 21st, so I can send the signed MOU on the 22nd. Said I hope that'll be okay. Yeah, and so Rita, again, I'm hoping that we can get something from DPHHS as a clarification that if we go past that point where the reimbursements are actually going to be approved to be released by DPHHS, that they can afford that flexibility. Again, until I have confirmation from DPHHS on that, I would say I'd still try to shoot for that 15th, but you may reach out to Megan Peel or Christine White on that issue. Shanna had a question about does our authorized rep need to be our superintendent? And so Shanna, that would actually kind of depend at the local level. An authorized rep, I would say, is at a minimum would be your superintendent. Some local districts, the authorized rep may be their board chair. Again, I'll kind of leave that at your guys' discretion. I didn't want to make it where it's just the board, but I know that some boards do allow or have delegated the ability to act as authorized rep in certain circumstances to the superintendent. And so, again, at a minimum, I think it would be the superintendent, but again, for some schools, it might be the board chair. And then Shanna had another question, says, Jay, the bridge period time frame is from when until when dates? So for the I'm sorry here, bridge period time. So Shannon, I mean, it may need a clarification. We say the bridge period time frame is from when until when dates? And are you talking about the 10-day window, Shanna? I don't know if you can jump on the mic.
Yep. Can you hear me?
Yes, I can. Yep.
Okay, so because you're talking about the bridge funds, but then you're also talking about supplemental payment, and those are two separate things, correct?
Yes, that's correct. Yep.
Okay, so the bridge funding, that was stuff that's happening at the beginning of this year. Things that we paid out. If we were to retain those funds, that would mean that we met those matches. Is that
Yeah.
correct?
So the bridge funding was that money that, again, that was appropriated by the legislature, was that $2.2 million. And so it was to cover any claims that were submitted as of July 1st of 2021 until that bridge funding actually ran out. That money was made available to cover the state share of the match requirement. So if you had submitted claims from July until December is when I think the last ones went. I think they went through like the 23rd or 25th, where DPHHS was processing them. For all of those claims that were submitted, that state bridge funding covered your guys' match requirement. And so again, that money has actually been expended as of the 28th. So starting after the 28th, any claims that are submitted now, that's when your school district will have the requirement to submit the state and local match portion from your guys' budget.
Right.
Yep.
So for us, we didn't have anything during that time, so we wouldn't, those funds I don't think pertain to us. I just wanted that clarification.
Yep.
And then you started talking about the supplemental.
Yep.
So I'd already typed my question. So the
Okay.
supplemental funds are the ones that you just answered. So I think I understand that portion of it.
Okay. Okay.
All right.
Okay. Yeah. And if after this, if you have need further clarification, feel free to give me a call and we can talk through it as well. So.
All right. Thanks.
Okay. And then Carrie, good question. So is there a special coding for the supplemental payment? My apologies, I forgot to touch on that. And so I'll be sending out a letter today that addresses this, but because that money is for regular just CSCT reimbursement, that you can use what the same coding that you're using already for that the receipt of your CSCT revenues. And so it's that for most schools, I think they're putting it in Fund 15 and they're using that 3356 CSCT revenue code. And so again, use your regular ones, and then as you at the local level make the decision of how you actually want to utilize those funds, then that'll determine what expenditure accounts you would use. Again, if it's something you were going to pass through, you would use similar account codes when you pay your third party provider. If you made the decision or your trustees made the decision to recode those and use them for something else, then you would have to determine which accounting codes would be appropriate to move those over. And then Shannon had a question. The supplemental payment needs to be board approved as to the discussion to retain or pay out. And so, yep, Shannon, I would say that is, that'd be a great place to start, because as funds come into Fund 115, my understand the statute states that at the discretion of the trustees, that those funds can be utilized as deemed appropriate. And so, again, as you receive that supplemental payment, it may be a discussion with your board as to what they think is the best use of that. Again, in partnership with your mental health centers, if you so choose to do that, would be a good policy. Oh, and then Megan popped in. Oh, good, Megan. And Megan says, yes, we have approved flexibility on date of signature of MOU. And so, Megan, are you on here that you can pop on and talk about that? Let me see here. Are you? Megan, I just promoted you to panelist, so can you see maybe if you can jump in? I can see you, but I can't hear you.
Hey.
There you go. Yeah.
Yeah, so we were able to confirm with our legal office that we won't be able to make payments for claims until we receive the MOU, but we do have flexibility in when your authorized signatory can sign it. And so, you will still can get reimbursed for claims in January if you're past that February 11th date. It just might be a little bit delayed.
So I guess I need clarification on that, Megan. So let's say like in the case where we talked about that the board wasn't actually going to meet until the say the 23rd, then they would still be able to submit it, but they probably still wouldn't get their actual payment until March then. Is that correct? So there still would be a month lag?
Yeah.
Okay, okay. Okay, so schools still can submit the MOUs, but again, as Megan is saying, it'll delay the payment until the subsequent month, right? Okay. Okay. Thank you, Megan. And so Mike has a question. It says, I'm told DPHHS has submitted questions/corrections regarding the FAQ. Are there updates in the works in response to that feedback? What will they say? When might those changes be available? And so, Mike, to date, I haven't received anything from Megan's group. We submitted the FAQ to them prior to us actually releasing it. Megan did convey to us that they wanted to have their legal staff go over it and that they may have some suggested revisions coming back to us, but I haven't got anything on that. Megan, have you? I haven't seen anything from you guys.
Yeah, I'm meeting with our general counsel this afternoon and then to go over what her comments were, and then I'll send them over to you.
Okay. And then Dustin had a question that says, please clarify the HCBS supplemental payment received in December are federal funds and can't be used for match. And so, Dustin, I think the payment went out, I guess, November, if you guys got it in December. And again, my understanding is, and Megan can chime in if I don't answer this appropriately, but the payments, again, is just a supplemental payment for services that already were provided starting back in April of 2021. And so those funds come into the local districts. Again, you would record those funds and receive them just like you would any other general CSCT revenue. But those funds themselves, if you're asking, can you take those and then use those to meet a future match obligation? I would say, hold on, let me think about that again. Sorry.
Yeah, so Jay, this is Cheryl. Let me jump in for a second. You're correct. Those are federal funds, and our FAQs have been pretty clear. You can't use federal funds for a CSCT match. What Jay has talked about earlier is one of the elements of what you can do with ESSER funds, and that also is in the accounting guidance, that if you have a budget shortfall, you can backfill that budget shortfall with ESSER funds, but you cannot use federal funds directly for a match.
Yeah. Thanks, Cheryl. Yep. Sorry, I was getting my wires crossed with the supplemental and then the bridge funding. So thank you. Okay. And then Denise had a question. You stated that the district that has bridge funding from Medicaid reimbursement revenue left over can use that money for future CST match payment because the bridge funding, from a state source, it would follow that district match funds from Medicaid reimbursement revenue left over can also be used. Hold on here. If from a state source, it would follow that district match funds from Medicaid reimbursement revenue left over can also be used for a future CST match payment because it was from a local source. So the rules changed with respect to the rule about not using Medicaid reimbursement funds for the future match payments. And so Denise, no. So we're talking two different things. Like Cheryl just talked about, that anything that you receive through the reimbursement for the CST program itself, the general CST program, those funds cannot be used over and over to meet future match requirements. Okay? But to be clear, that
could I jump in for a second on this one too with you?
Yep.
So I understand, I think the core of the question, and we're looking at that differentiation, and it's what Jay has communicated to you is also what's going to legal to make certain that we're all spot on. So we appreciate the question, and we'll continue. So we're looking to see everywhere that there is potential flexibility, and Jay believes there may be here, and that's what he's been communicating to you.
Right. Yep. Thank you, Cheryl.
Thank you.
And I don't see anything else, guys. So is anybody on the panel? I guess I've got everything, looks like in the chat box. We got those addressed. Does anybody on the panel want to jump in? Thank you, Ann. We appreciate that. And Alex looks like he's got a question related to changing CSCT teams. So Alex, if you, let's see here, are you on the panel? Let me see here. Alex, I just brought you in, so you should be able to unmute and ask a question if you want.
I think I'm unmuted here.
There you go, yep.
I know I'm not the only one that's had this problem. Acadia, Montana, basically, I don't know if it's sold or handed off or whatever. Numerous teams in eastern Montana to Yellowstone Boys and Girls Ranch in June. Okay. A lot of us teams that are in that boat, talking to YBGR, still have not got our paperwork processed with the state of Montana to change from those provider A to provider B, if that makes sense.
It does.
Which also means that all of our billing, going back to June, is basically on backlog. And that's going to get eventually dumped on this. And I don't know how many teams it is, but I know it's numerous teams. Won't get any satisfaction from that government match now, that $2 million. And I don't know what we can do about that. But that is literally an issue in the enrollment side with Conduent or whatever that company is that runs it. I started doing my paperwork as early June. I know a lot of other schools, the same thing. And now we're going to be stuck with not getting our kind of appropriate share of that $2 million. I don't know if there's anything that can be done with that. I don't know if that's even a reasonable problem, but we kind of got hit in this A to B transfer that really has this whole other thing came into play, and just kind of realizing that through these phone calls, I haven't asked that question because I kind of just thought it was my problem, but then I found out yesterday, I think there's numerous teams that are in the same boat.
Yeah, Alex, thanks for the question. And I may defer this to Megan a little bit, but I will say that I did have a discussion with another school district yesterday that they had a similar issue where there was some late invoicing or invoices that have not been submitted. And they're kind of asking as to what it is that they could do. I actually did forward those over to Megan's team. So Megan, I might ask if you could answer that question.
Yeah, so when we found out about that, like hold up in enrollment and the changing of providers, we reached out to the provider enrollment team at Conduent and then the people at DPHHS that oversee and have escalated that to be resolved. And we will, follow up again today and see what answers that we have for that. But I think that what school district were you, Alex?
Roberts School District, Roberts, Montana. Sorry, my son's crying in the background.
Oh, okay. I think that you were on the list, but we'll make sure that we follow up with you.
And YBGR is the program that I know has been having trouble getting all these programs across. And it's us. It's not. I'm not blaming YBGR. We're supposed to do the paperwork, and it's just kind of all just magically sitting at Conduent with this. Apparently, they had a change of backing computer program or something like that, and all this stuff was just kind of just hung out.
Right. Okay. Thanks, Alex. Like I said, Megan, go ahead, Megan. Were you going to say something?
Oh, I was just going to say that YBGR reached out to us as well to help bring that to the top, and we'll make sure that we get back with all of you.
Right.
Thank you guys very much.
Thanks, Alex.
And I just, I'm always kind of the sticky wicket on some of this stuff, but I do appreciate you guys trying so hard this transition's been difficult in a lot of ways. And I appreciate all the communication, all the support, and all the future support as we kind of figure out auditing this and everything else. So thank you very much, you guys, on all 3 layers.
Thanks, Alex. Appreciate that. And then looks like Kevin had a question is do we have an account code that the schools should use for their match payment? Yeah, so then Kevin, in the accounting guidance, there is a suggested accounts that you can actually use or journals that you could use for the actual receipt of that. For most of you guys' general CST revenues, again, it's going to stay with that, 3356 that you use. I think that there are a couple schools that use a different one depending on what services are being provided, but that's the general revenue. And then for each of you guys, for when you actually decide what you want to do with the match payments themselves, then individually you guys will have to kind of determine what's the best coding based on how you're going to utilize the funds or recode those funds. And then Gary's asked, when can we expect a legal decision on the use of Medicaid reimbursement for future match funds? So Gary, what I'll say to that is that right now we're still waiting for our legal teams to finalize that. And as soon as we get that, we'll make sure that we send out a communication to everybody if there's an update or clarification to that. And Jessica says, did all schools receive the supplemental payment in December? Where can I verify if we should have received this, and should I be concerned if I have not? And so Megan, do you guys have that posted on your guys' webpage, which schools got the supplemental payment?
No, and there wasn't a supplemental payment in December.
I think it was in November. It went out in November, but yeah.
Yeah, so there was one in November, but there wasn't one in December. So were you, let's see, who asked that? Jessica. Did you receive a November supplemental payment? Oh, no, we did not. Okay, do you mind sending me an email with your school district and I can check to see?
Okay.
And there's my email.
Okay. And then Gary, real quick, just a quick point of clarification on your question about the use of the Medicaid funds. So the legal decision that we're actually waiting on DPHHS because they're reaching out to CMS to get that clarification. So just so you're aware of that. And then I see a question here about, it says in the past that we would see payments weekly. Is it correct that we will now see the payment on a monthly basis? And so based on the schedule that OPI and DPHHS put together, that yes, as it stands, that that will be on a monthly basis. One thing I think that I don't know, we've looked at this, that as we move through this process, that is there opportunity to potentially do like a every other week kind of a payment system. And I think part of that we'll continue to have discussions with DPHHS as the process progresses. But as of right now, that yes, that would be on a monthly basis. And then Chris asked, what documentation should we have ready for our auditors regarding the CSCT match? And so if you go back again to our FAQ and our accounting guidance, there's some recommendations that OPI has made in those documents. I think if you're primarily talking about the receipt of the match and the cost sharing model around that we have recommended that school districts consider documenting direct and non-direct expenses that are equal to that match amount. Again, that's still a recommendation, but that is also in our FAQ. And
Jake, this is Cheryl. Rhonda's had her hand up for a while.
Oh, my apologies. Rhonda. Let me jump over here.
Can you hear me?
Yep, I can hear you.
Okay, thanks, you guys. So I have a couple questions and clarification, really. The supplemental payment that everybody is talking about, we received the money in November. Can you guys clarify who that money is intended for? Was it intended for the schools or was it intended for the providers?
Thanks, Rhonda. Thanks for the question. And so I'll tell you what I understand it, and then Megan can jump in if she wants to add something. So the way I understand it is that Medicaid had made those supplemental payments available to the provider. Okay. My understanding that the term, when we talk about provider under the Medicaid world, that means you as the district. Okay. So the funding is actually a supplement that's coming to the district, or AKA the provider, for those services again that happened back in April of 2021. Okay. In talking with Megan and her team, there is some language, I believe, from CMS that does talk about, that the intention there is to help with the community-based services that are provided. But as those funds actually come into and booked in, again, they're going to come in as a general CSCT reimbursement, like they would have with any other those funds that were received. Okay, as those funds come into 115. Again, statutorily, it's the discretion of the trustees to make the decision as to what's the best way to utilize those funds. As I kind of mentioned in the beginning of the discussion about, what does that mean? Does that mean that you would have at the local level some discussions with your guys' mental health providers that a portion of that would pass through to them? Or again, if the trustees would make that decision that they have other areas that they'd like to target those funds for. And so I would say it's up to your trustees to make that decision.
Okay, so the concern for us is our Western Montana Mental Health Center they wanted that money. They asked for that. And so we were never clear on if that was for the school or if it was for Western Montana Mental Health as the people that are working with the students and sending the remittances in. So I'm not sure what we do with that. And then my other comment, mostly for Megan, is when Alex was talking about his school and his team switching over, our issue was that Western Montana Mental Health has been very behind in their remittances. So we just received a report and a remittance in January for dates of service provided in October. And that's what we now consider them as caught up. So I don't think that we've ever received the benefit of any bridge funding either. So I don't know if that's something that you can look into like you are doing for Alex, or if it just is what it is.
So first about the supplemental payment, I mean, the payment is intended to support workforce recruitment and retention of direct care workers. And so it's intended to be an enhanced payment for Medicaid services that were provided in April through September. And we generally had paid $17.67 per unit during that time period. And so it's like a 15% increase to that rate. In terms of your mental health center and the billing, I mean, we certainly can look to see what was billed for your school district, but can't really change the end result of if they didn't bill. So you're under the impression they didn't bill at all for October, November, and December until January?
They've been very behind in their billing up to like a whole calendar year. They're kind of, I would almost consider them submitting October services as being catching up. So I don't think I'm being very clear with my concern, but if the bridge funds were for a period up until December, they had never turned anything in for the appropriate services in the time frame for us to get any bridge funding for this. So now we're paying them for October services in January, but we will have not had any opportunity to use bridge funding for that. Does that sound right to you? that make sense how I'm wording it?
Yeah, yeah.
Okay.
And unfortunately, that's correct. If they didn't submit any bills during those months of October, November, and December, when we were utilizing the bridge funding for the state match, we have expended all of the bridge funding.
Okay, that's what we thought. Thanks for the clarification.
Great, thanks, Megan. Thank you, Rhonda.
Thanks.
Okay, so no other hands raised. I'm gonna go back to the chat box. And so Gary had another question. It says our trustees have the authority to determine how we spend the money from our Fund 15 account. Therefore, they have the authority to allocate the Fund 15 reimbursement can be used for paying future match funding. And so Gary, you're right that the trustees do have that discretion, and is that their approval of how those funds would be used. But again, we go back to that, although they do have that authority, you can't take that CSCT reimbursement funds that came through as that match and use them over and over. Okay, this is also indicated if you look in the MOU that there's a section there that talks about the requirements, and that is actually listed in there, is that you can't use the funds over and over. So. Let's see here. It looks like Dustin, thank you. Looks like you had a link to the supplemental payments potentially there, Megan. And then Jane had a question. Our Acadia person told us that they would be billing us for the supplemental payment. So I'm understanding from you that we don't have to pay them the money. We can keep it and have the trustees decide what to do with it. And so, Jane, so again, I'd go back to, again, that understanding of how the flow of those dollars is, that those funds are coming into the provider, which your district is the provider. Of course, you're right, your mental health center is the one that provided services. But as the provider, as those funds come in, I would still say that it's at the discretion of your trustees as to how those funds would actually be best utilized. And so if that's a conversation with Acadia, and that decision is made, then I would, again, take that to your trustees to make that decision.
Hey,
But-
Jay,
but the requirement-
let's just add that one piece that Megan talked about related to the requirement of the use of the funds supplemental. Megan, could you go through that one more time too?
Yes. Thank you, Cheryl. The requirements for that money, the requirements of use for that supplemental payment is for workforce recruitment and retention of direct care workers in the mental health area. So, the mental health centers like Alticare or YBGR, Intermountain, they received these supplemental payments for other home and community-based services that they provide, because they're the staff that are, boots on the ground providing the services to kids. So for other services that don't have this school-based component where the school district is the provider of record, the mental health centers received the supplemental payment for things like targeted case management or home support services. So the requirement for spending the money is workforce recruitment and retention of direct care workers. So, the easiest way that would happen would be for the mental health centers that employ those people.
Hey, Megan, this is Cheryl. So I have a question. So if school districts have hired additional behaviorists to support, would that be a direct care? Would that be considered direct care in this?
No, because it wouldn't be for the Medicaid direct care workers.
Okay, thank you. Hey, Jay, it looks like Shara has her hand up too.
Okay. Hey, Shara.
Can you hear me?
We can.
Okay, so I guess I have two questions. First, related to the supplemental payment. So we have Western Montana Mental Health. They're the ones providing the services, and with the old system, they would submit their claims. Their Medicaid payment would essentially be receipted to us, and we simply just passed it through. So the supplemental payment in theory is for all services they provided. If I'm understanding Megan correctly.
Yes. Yep, that's correct. It's just an enhanced rate for services that were already delivered.
And probably an attempt to keep their people employed and providing services to us.
Yep.
Okay. My other question is on the bridge funding piece. I understood that basically money we started receiving in this school year was bridge funding. So anytime we got payments, I put it into like a project report code for bridge funding. And then it simply on the old system got passed through to CSCT like we've always been doing. So it was in and out.
Right. So, and again, sure, I think it goes back to it. I think everybody has different circumstances, and I guess that was kind of part of my question and comment is that, let's say that, you guys had a negotiated rate of, $65. You guys received reimbursement of $100, which $35 of that came from bridge funding. I don't believe that everybody actually passed through that $35 because when they got their invoice, it would have only been for that $65, right? And again, some people I think have actually passed it all through like what you're kind of presenting. So that was part of the discussion is that what did schools actually do with that? Because it sounds like there was varying treatments of how that bridge funding was being used.
So how do we know what we received is bridge funding versus the previous type of funding?
So Megan would be able to provide a report because she has, when we, as those payments were going out, they actually logged how much was actually bridge funding, right, Megan?
Yeah, but I mean, the thing that we have to be careful about, like how the money is described is any reimbursements that you received for services rendered is just a Medicaid payment for services. And it's just Medicaid revenue. It's not, we don't pay differently because if it was bridge funding or whether the schools pay the state share, like the contribution of the state share is completely separate from the reimbursement for services. And so I wouldn't think that the accounting would be any different. But then in terms of how much you're paying your mental health center, my understanding is that the mental health centers are working with each school district to negotiate their rates, and that generally speaking, the rate for a non-frontier area is about $62.40 or something like that, and then higher for the frontier counties, but that would be the amount that you would be paying them. It wouldn't change depending on the bridge funding.
Megan, let me take a stab at this, and you and Jay say, Cheryl, you're completely whacked, and we all know that, or maybe you got it this time. So the idea is that you're getting Medicaid match to the state fund match, which has been bridge funding for this short-term period. So the state funding and the Medicaid match is what gets sent to you in order to meet your bills. Is that a fair way of communicating that?
Sorry, can you
Yep.
just say one more time? Sorry.
Yep. So if we looked at the rate, I think it's $96 non-frontier. So if we rounded that to that Medicaid is going to authorize $100. Of that $100, a portion of that is the state match dollars. The other portion of that is the Medicaid. It's not $135 that comes back. It's
Right.
still whatever that approved rate is that's blended with both federal and state dollars to pay your bills.
Yes.
Thanks.
So I guess where I'm confused is we were receiving payments on, I'm going to call it the old system, up until just recently. I guess it was January. We got our first Medicaid payment that our provider billed us for, claiming that they billed $96 per unit. So anything up to that point, we were going on the old system where it was paid to us and we just reimbursed it back to them. Is that not bridge funding?
So I'm going to take a stab and let the experts run this again, Shara. $96 per unit. Under the old system, a unit was 15 minutes of service. So if you were being billed at $96 per unit, when I think Megan told us it was like $17.67 before, that is huge, and bridge funding would not cover if you got billed at $96 per unit. That's a pretty significant. So I'll stop there and let Jay and Megan jump in because they're our top experts on this.
Yeah, so prior to October 1st, any claims with dates of service before October 1st were under the 15-minute unit payment of, and it was $16 or $17.67 per 15-minute unit. And then starting October 1st, so dates of service after October 1st, we moved to the daily rate of the base daily rate was $96 per day. In terms of the bridge funding, that's really based on date of payment. And so if your mental health center didn't bill anything until after December 28th of this last year, then you wouldn't have used any, you wouldn't have received any benefit from the bridge funding, because that was, we had $2.2 million total in bridge funding, and it was fully expended as of December 28th. But they are kind of different, the state share versus the payment. They're different pieces of the process.
Okay, well, I'm going to forego the bridge funding part of it. So the last invoice that I received was at the apparent $96 per day per eligible student. And it's now outside of this system where we have to provide a match. So I'm trying to make sense of the documentation that I got that we're supposed to use the FMAP reimbursement, which apparently is different for Medicaid versus CHIP funded services. How can we even determine that based on what our providers giving us, or what do I need to get from my provider to determine that?
Are you working, are you trying to figure out how much to pay your mental health center?
Yes. Like what our contracted rate should be.
So Megan, maybe what we should do is maybe we can have you, Sharon, and myself. Maybe we could have just a one-on-one meeting. How's that sound?
Yeah.
Would that be okay? And I can get something scheduled. Would that work for you, Shara?
That would be perfect.
Okay.
I have a feeling I'm not the only one in this boat, but I appreciate the help.
No, and that's great. And I think this actually would be a good opportunity for us again to update our FAQ, because if I'm sure, like you said, if you've got this question, others are going to have that as well. So this would be something that we could address, and we can actually add that to our FAQ. So I appreciate you bringing that up. So
Thank you.
okay, guys. So I think we're at our actual hour time, and I want to let everybody know thank you so much for coming and participating today. I hope this was helpful. And as always, as we move forward, if at any time you have questions, please don't ever hesitate to reach out to me. I'm happy to have any one-on-one discussions with yourselves individually or with your guys' district's team. So with that, I want to say stay safe, stay warm, and everybody have a great weekend. Bye.